This evening, I'm going to be doing an assessment on my daughter Kiara. I'm going to do her abdominal assessment. I would first start by looking at her belly to look to see if there's any deformities or elevations from a hernia or anything like that. So looking at for any abnormalities first. And then once I decide if everything's okay, then we're going to auscultate bowel sounds first before we start palpating. I'd start over the left lower quadrant. And I'm going to listen for 1 to 2 minutes until I hear bowel sounds to see if they're hypoactive or hyperactive. Hers are very normal. Okay, and then if had the bell of the stethoscope, you can actually push a little bit harder and listen for the aorta and the renal, iliac, and femoral arteries. And I can hear her heartbeat. Not necessarily hearing anything down here. Okay. And then we're going to percuss. So I'm going to start by tapping on her belly. I want to hear tympany over her air-filled organs and dullness over her solid organs. So I'm going to start at the top. I do hear a change over the abdominal organs. Okay, and then to do the liver, I'm going to have her take a deep breath, and I'm going to try to percuss down to see if I hear a difference between the dullness and the tympany. So can you take a big breath for me? Okay. Right there. I gotta put a little mark there. So as we mark, we should have approximate 6 to 12 centimeter area span where her liver is. Of course, she's small, so I'm not going to. I'm getting about 7. All right. And then I'm going to start to palpate. We do light palpation first. Tell me if you feel any pain. Just with the fingertips. And then we do the same with deep palpation, trying to feel any masses or anything deep. Any pain? Sorry, I know that tickles. And to feel the liver, I'll put one hand under there and I ask her to take a big breath. And I should not feel her liver, and I don't. Okay, you can exhale. Okay, we're going to do the same thing over here. Actually, I'm going to have you roll up on your side towards me. And then I'm kind of backwards now. Okay, I'm going to. And then there's a change right in there. And then to feel your spleen, I would have again try to take a big deep breath. You do feel something there, but I don't think it's your spleen. Okay, all right, lay back for me. Okay. All right, so we'll do that, and then so liver, spleen. To check the kidneys, we'll want to. I'm tickling her. We'll want to put our hands together when she's relaxed and try to push and see if we can feel if I can feel the kidneys on either side. You have to relax for me. Okay, that's okay. And then we would check bladder area, so I would move down a little bit and try to feel, to see if I can feel the edge of her bladder anywhere. And I'm not feeling the edge of your bladder. Gotta pee. And then you can also feel for the aorta by taking your finger and your thumb and kind of push it in to kind of see where you feel the heartbeat, and then measuring. And hers is in normal amount. And then the other thing I can do is I'm going to take the pin and we're going to check her reflexes by stroking it to see if her muscles contract. And they do. Okay. Okay. Thank you very much. I appreciate you watching.